Welcome, everyone, to Tabadlab's 50th Policy Roundtable, and congratulations to Tabadlab for this big achievement, with a topic that may create more questions than it answers: family planning as a vital element of climate resilience and social justice. My name is Samia Liaquat, and I am the Director Impact at Tabadlab. We have a very distinguished panel with us today, and I'm excited to be speaking with them on the topic of the intersectionality of reproductive health rights and climate change. To begin with, I'd like to introduce Dr. Faisal Sultan, who has been the CEO of Shaukat Khanum Memorial Hospital and Research Center since 2003, for a period of 20 years, excluding 2 years during which he was brought in by the Prime Minister as the Prime Minister's focal person on COVID-19 to really set the scene for combating the coronavirus pandemic, and later served as Special Assistant to the Prime Minister on National Health Services. Welcome, Dr. Faisal. Good to have you with us. Next, I'd like to invite Dr. Adil Najam, who is a leading expert on development and environment related to the Global South. And Dr. Adil has been, I think, on policy roundtables before as well. He is the Dean Emeritus and Professor of the Pardee School of Global Studies at Boston University, and previously was also Vice Chancellor of LUMS. I hear, Dr. Adil, that you are at Oxford right now these days, and it must be freezing over there from what I've heard, but welcome to us. Next, I'd like to introduce Dr. Zeba Sattar. Dr. Zeba is a senior associate and directs the Population Council in Pakistan. She's extremely well known for her research on population and demographic trends, and has advised the government of Pakistan on national policy at various forums. Dr. Zeba also manages the program strategies of the council that look at poverty, gender and youth, and reproductive health. Welcome, Dr. Zeba. Good to have you here. Next, I'd like to introduce Dr. Aisha Rashid. Dr. Aisha is Pakistan Country Director of Pathfinder International. She's a public health specialist with a strong background in reproductive, MNCH, and nutrition. And has worked in Pakistan designing several programs for health system strengthening as well, and has a master's in public health from Johns Hopkins University. Welcome to the panel, Dr. Aisha. And last but not least, Anam Zeeb. Welcome to the panel. Anam has also been a panelist on previous TPRs. Anam is a climate change expert and has worked on climate change adaptation and disaster risk reduction as a researcher and practitioner for more than 10 years. And her focus is on working with the most vulnerable households. And currently, Anam is coordinator at the German Red Cross for a project called Climate Advocacy Coordination for Resilient Action. So welcome to all my panelists. I would like to just begin by introducing the subject a little bit and talking about why we're here today. So Pakistan is the 10th hardest hit on the World Risk Index regarding climate change in terms of exposure to natural disasters, as well as vulnerability, which includes lack of coping as well as lack of adaptive capacities. As per the census of 2017, we had a population of 208 million and growing. And today, using the same, if we look at the same population growth rate, we are currently at 235 million. We also have the 5th largest number of youth as part of our population. So 29% of the population is between the ages of 15 and 29 years old. And if we continue with our current growth rate, by 2035, which is not that far away, we would have crossed the threshold of 300 million people. And when we talk about 2047, 100 years of Pakistan, we would be hitting over 400 million people. The latest Pakistan Demographic and Health Survey, which was 2017 to 18, confirms that there's been little change in fertility levels since 2005. So really, a large number of years where women have been bearing an average of 3.6 children over their reproductive lifespan. And then critical drivers, such as the modern contraceptive prevalence rate, have remained constant at around 25%, also for a number of years. The unmet need for family planning services remains high at 17%, indicating that there are millions of married couples who are unable to receive adequate access to information and services to plan the families that they desire. In 2018, the Council of Common Interest had adopted a set of 8 key recommendations aiming at accelerating the efforts of the government to reduce population growth rate, lower the total fertility rate, and increase the modern contraceptive prevalence rate. Also contributing here to SDG 3.7. SDGs are the Sustainable Development Goals, and Pakistan is a signatory to these goals. The target here is to reduce the population growth rate to 1.5% by 2025 and to 1.1% by 2030 from the current high of 2.4%. This means increasing the current contraceptive prevalence rate, or CPR, to 50% by 2025 as a priority and by 60% by 2030. So this is, I would say, a very controversial topic, right? And I would like to ask the first question to all my panelists. And really here the question is that, is there enough evidence to suggest that population growth and climate change are linked? And that without efforts to manage population growth through providing reproductive health and family planning services, building climate resilience becomes that much more difficult. I'd like to start with Dr. Adil Najam. I'd like to give all of you each 5 to 6 minutes. So starting with Dr. Adil, then we could ask Dr. Zeba, Dr. Faisal, Dr. Aisha, and finally Anam. So please, Adil, go ahead.
Very much to you, and thank you to Tabadlab for having this conversation. It is wonderful to be with such a august set of panelists, friends, and experts, and people that one has amazing respect for. I wish you hadn't started with me, and in some ways, maybe I can speak a little less and come back at the end. I have so in terms of the way you phrase the question. Yes, population growth is one of the biggest, possibly the biggest, even bigger than, or certainly more immediate than climate change as an existential threat to development in Pakistan as well as the world. It is clearly a factor in how climate will both have its impacts, but how climate change happens, because climate change is really driven by consumption. And that is where the rub is. I think the problem becomes when there is a one-to-one correlation, that climate change is somehow caused by population. And this is why I'm slightly uncomfortable by the way the title of this discussion has been structured. There is a long and contentious politics to that link. There's nothing contentious about the importance of population. What is contentious is the argument, or has been, and to me, that's an argument that's done, it's over with. Was the argument, particularly in the 90s, that really the driver of climate change, the fault, if you will, is that there are too many of you poor people around, right? Because once you talk about too many people, they're mostly about too many poor people. And that's where the important linkage is. And that leads to a certain politics, has led to a certain politics over time, which has been contentious. Not because overpopulation, if you will, is a problem in itself, but because overpopulation becomes the driver and takes attention away from overconsumption, right? And again, we go back to the 90s. This is a solved problem. There was this famous equation, if you will, the Ehrlich-Simon debate was around that, and the Holdren equation was I is equal to PAT. I is impact, P is population, A is affluence, T is technology. What that means is that population becomes a very important driver, but in terms of consumption. So if you are consuming at your level or my level, then one of us is consuming probably more than 10 people who are sort of lower income Pakistanis. And therefore, if all you're interested in is managing the level of climate, should you be interested in having those 10 people be nine? Or in reducing our consumption. Now, again, this is very tricky ground, so I'm very uncomfortable talking about this because it starts seeming as if what one is saying is that we should not worry about population. That is not the point at all. That is not the point at all. There is good, real, deep, serious, immediate reason to be thinking about population in a country like Pakistan and in the world. And it does not need to hide behind climate change. That is an important primary, that should be an important primary goal in and unto itself. So there is what is contentious or what has been contentious is this political debate that comes up, that you see in images like this, right? And you see them all over the world, and you've seen them all over time, where essentially then population is kind of presented by very good people, not out of malice, but because it's an easy link to confuse. It becomes it is presented as if it is the cause of climate change. So that would be my sense, and I hope I can come back to this, and I hope I'm not misunderstood here. I think population ought to be a primary goal in and unto itself. It doesn't need to sort of, we shouldn't be talking about it because there's climate change. Even if there wasn't climate change, even when we weren't talking about climate change, we should have been doing much more on thinking about population management. I'll give you two examples. There's a lot of talk these days in Pakistan about Bangladesh. And Bangladesh is a very interesting example, both economically but also from a population point of view. When Bangladesh became Bangladesh from what was East Pakistan, there was near parity. Bangladesh was slightly larger in population than what was then West Pakistan and is now Pakistan, and that is Bangladesh. So here we have a natural experiment. Right? And a lot of what people talk about in terms of how Bangladesh has been doing well can actually be attributed greatly to population. Their population, I believe, Dr. Zeba can check me, I may be wrong, is around 170, 180 now. Ours is crossed 200, whereas we started in 1971 with the two being nearly equal, Bangladesh being slightly larger. You take those growth numbers, etc., and change that denominator, and you find that a lot of the dividend that Bangladesh is seeing economically is because their population became less. That has not made them less vulnerable to climate change. That has not made the world less likely to prone to climate change because it is mostly poor people. But it has made the people who are there more resilient because they are economically becoming better off. And it has happened primarily by or not if not primarily, largely because of the empowerment, particularly the economic empowerment of women, which led in itself to better health. So what I'm saying again here is that we ought to look at both these issues. They are both existential, they are both important, but simplistic linkages, as we have seen in the 1990s, are dangerous, especially as climate justice becomes more and more of an issue, and can lead to this very clear, as we've seen in the past, sort of linkage. Climate is happening because of poor people. Last thing, and then I promise to shut up. Here is the fact. If I were to make a list of the most important things that Pakistan should do in policy, population and climate would be right up there, above politics, above security type issues, above even economic issues that we are all preoccupied by now. Population will be right up there, climate will be right up there. But if I were to make a list of the most important things you can do for population management and make a list of 10, I don't think climate change will show up in that. Similarly, if I were to make a list of the 5 most important things you can do for climate in Pakistan, population will not be there. That doesn't mean it's not important. If population was managed better, there will be climate benefits. If climate was managed better, there will be population benefits. But this piggybacking of we think two issues are important, therefore, voila, let's put them together, is, I think, sloppy policy thinking. And we've seen this very often, especially in a country like Pakistan, where our policy capacities are less. This thing of just wrapping up all the issues together, in fact, has the result of distracting from all those issues rather than strengthening them. Now, this is not to say they shouldn't be linked. They should, because the link is obvious. But this is to say that we need to take the importance of each one of them on its own merit, because they are central and they are existential.
Thank you, Dr. Adil. That's really insightful. I'd like to go over to Zeba, please.
Thank you, Samia, and congratulations to Tabadlab for holding this discussion. And I echo what Dr. Adil Najam said. It's really a privilege to be on this panel. And fortunately, I think I totally agree more or less with what he has said. I know we talked offline just before and said, God, this is going to be a contentious discussion. But I think you have chosen a contentious issue. It's a touchy issue. I remember several years ago at the World Economic Forum, where we were part of a population growth group, and there were about 5 groups working on climate change, setting joint targets for goals for the SDGs, I think, at that point. And we walked over and we said, don't you think that our 2 groups, or your 5 groups and our group, should really be talking to each other? And there was almost like a barrier that was put up. Clearly, this was resisted badly. And a more recent example is in Sharm el-Sheikh. The world turned 8 billion while Sharm el-Sheikh, the COP27, was happening. And we kept waiting that there would be some mention of population, but there wasn't, because indeed it is a contentious issue for the reasons that Dr. Adil Najam has really pointed out, that it kind of takes the debate away. And there are 2 other arguments that I want to put behind that, is that if there is a discussion about population issues, it would dilute the climate change discussions, I would say, for 2 reasons. One, it would imply that the developed world, which is more responsible in a way for the maximum, the guilt or whatever, the pile-on the responsibility is on the developed world that consumes more, emits more, is responsible for the negative consequences of climate change. And we in the developing countries are getting more of, we're the affectees. So if the debate moves, if you put in population forcibly, I would say it would be a kind of forced discussion. Then it would turn to, in a way, turning to governments and asking them to really come up with family planning policies. And that is what I think Adil Najam perhaps saying, that the title of your I think all the elements of what you want to discuss today are important. The 2 sectors are linked, but I think if governments were asked to really institute family planning programs just to reduce climate change, that would be absolutely wrong, morally wrong, and also basically it just wouldn't work. The other one is that, of course, as I said, the responsibility lies, it would take away the climate justice argument altogether, because here we are asking those who are responsible for climate change for additional financing, to bear more responsibility. And it's not just countries, it's industry, for instance. So it's industries that cause a lot of emissions versus, let's say, agricultural activity, which actually does not cause emissions, but suffers most because of climate change. So there are multiple reasons. But when I look at Pakistan, and I look at why we are vulnerable, and when we move from the discussion from mitigation, which is what the world is really talking about, really they're obsessively talking about mitigation, commonly shared goals about reducing the temperature, whether it's 2 degrees or 1.5 degrees, global warming, etc. But when we actually come to ourselves and what is important for Pakistan, then, I think that in the framing of what we do to build adaptation strategies and particularly to build resilience, I would say that argument falls apart. I think that there's a very strong argument, in fact, that I don't know whether I would have used the word family planning, Samya. I would have used the lowering of fertility. And Dr. Adil just talked about that. What has Bangladesh done so well? They've lowered their fertility in a record time, and through voluntary family planning, that was the tool. Of course, also they empowered women, but they empowered communities. They made it acceptable, family planning. And incidentally, ironically, Bangladesh was prompted to take on such a strong population policy soon after independence, because they were in fact really scared of the outcome of big, huge calamities that they just faced, like cyclones, etc., and the damage they call. And just to end my argument, I would say, if you look at the floods, they put us on a fast forward track to have to think about all the issues that you want to discuss today. But there has been a calamity that has affected millions and millions of households. And another one is likely to come. If it's not next year, it will be soon. We can almost predict it. And the dimensions of the outfall, the numbers affected, the numbers of pregnant women who were displaced from their homes, households destroyed, the numbers of children that the women have who belong to these climatically vulnerable areas. And if there's time, I'll say why I think that it was a story that was waiting to unfold. These were the very areas we knew would be most hit, and we didn't really do anything. And these were also the areas where services are least available. In fact, they don't have access. That's why the relief work didn't work as well. So I think there's strong arguments, and we can take those up, as to why Pakistan should make population as a part of the conversation, not linking, because the evidence does not, there's no causality, but there are a lot of associations. So I think we can't say this causes that, absolutely right. But things can be, if fertility was lowered for reasons, multiple reasons, even much beyond or before climate change, it would make the task of building back resilience, rehabilitation work all the more easier. So I'll stop here. Thank you.
Thank you. And yes, we are going to be discussing Pakistan in the next question. But first, could I request Dr. Faisal Sultan for his views?
Thank you very much. I don't think I can really add too much to the specific question asked over what's been said already by Dr. Adil Najam and Dr. Zeba Sattar. I think the issue of linkage isn't so important from this direction, in other words, the causality direction, as it is from the other direction, which is the ability to cope with the challenges that are already there and are bound to be worse pretty soon. I think our population, whatever size it is, and our ability to take care of this entire population certainly makes us very poorly prepared for the challenge that is to come and that is already here. Whether it is climate change in itself and the impact of that, or overall, inherently, in its own place, in its own self, as Pakistan, for our survival as a vibrant country, it is important that we are able to match our resources to the population that we have, and we are able to educate, house, clothe, feed the children that we are bringing to life. That, I think, is the crux of the matter. So while the title, the word climate and population are linked in a way, but not necessarily in the causality way, in this direction. In other words, our population, whatever it is, may not have had, or we cannot really conclusively say too much about it as to it having caused any direct climate change as far as we are concerned. Yes, there is a global impact of more people living and how we consume, particularly a few things, water and meat and so on. But nevertheless, it is important for us in the context of how we are able to deal with it, our resilience has been beautifully enunciated. So I'll just stop here. I think that I would not belabor that point. As the discussion goes forth, perhaps I can add more. Thank you.
Thank you. Thank you, Dr. Faisal. Dr. Aisha, could I ask you to weigh in?
Thank you so much. So very, very informative. And thank you so much for Tabadlab for bringing me here and talking about this and raising such a crucial issue. So very, very informative thoughts and messages said from my previous speakers, and really not going to disagree with them in the argument that yes, I mean, catastrophic climate change events are not what we expect that will arise out of overpopulation. But I'm going to steer this and digress from them and sort of disagree with them in a different way. Yes, catastrophic climate changes may not be caused by overpopulation, but because of overpopulation, the catastrophic effects of climate change are felt more by overpopulated, poorly nourished population that's on the ground. Overpopulated areas may have, may have lesser and poorer healthcare, poorer housing, lack of services, so they'll be impacted more deeply by climate change. And that's what we see on the ground. So this is where the poorest will be the hardest hit, because they're overpopulated, they're undernourished. You'll have higher mortality, higher morbidity among women and children, who are really the worst hit in an overpopulated area. And that's really the impact of climate change that we see, and that's the link between population and climate change that we see. And while we're not saying that overpopulation is, directly impacting catastrophic climate change, but there are some climate change effects that we'll see as a result of overpopulation. For instance, deforestation is an impact that I see is happening due to overpopulation, when the farmlands are being taken over by housing or other areas, and those are changes that we see impacting. But for us, when we implement things on the ground, we do see that in overpopulated areas, when there are catastrophic climatic-led events such as floods, earthquakes, the effect on the overpopulated areas is higher. You have higher burden on the system, higher burden on the health systems, which then fails to cope with services. And then you have greater loss of life. And then a rolling impact on development generally of the country. And that's really where I'm going to try and give time to other people to talk about as well. But really, our point is that in an overpopulated area, or in a place where fertility is less controlled, and you see the poorer effects of fertility on the health process of an individual, that's where you'll see climatic effects more. Thank you.
Thank you, Dr. Aisha. Anam, I'd like to now turn to you and tell us a little bit about your thoughts on this issue. I think you're on mute, Anam. If you could turn your mic on.
Thank you so much, Samia, and thank you to all of the panelists. I'm honored. It's a privilege to be here. I don't want to belabor the point too much, but I think the way that this conversation is going, we're already talking about this issue as a climate justice issue. Since we're speaking about it in terms of population or overpopulation itself as a driver of climate change, is perhaps not the way that we should be looking at it. I think the panelists before me have already spoken about this very well, but carbon emissions of the richest countries are orders of magnitude larger than those of developing countries. We have all read this Oxfam report that talks about how the richest 1% emits so much more carbon dioxide than the poorest 1% of people, the poorest 50% of people actually. And of course, the United States, for example, the average American emits 21 tons of carbon per year, as compared to a person, for example, in sub-Saharan Africa who would emit something like 1.6 to 2 tons per annum. And similarly, in Middle Eastern oil-producing countries like Qatar and the UAE, Australia, United States, Canada, the emissions are really high, and they're the highest in the world right now. But it's also very important for us to remember that it's not simply a rich versus poor countries divide. There are huge emitters in poor countries and low emitters in rich countries. So we're seeing that this is something that is very much interlinked with existing inequalities that exist within both rich countries and poorer countries. This is something that Dr. Adil touched upon. And then one of the common arguments that you get is that overpopulation is putting a lot of pressure on the climate and on natural resources and on our ecosystems. That also, it kind of highlights the complexity of this problem, because the richest fifth of people, for example, in the world, consume something like 9 times more meat, or they have access to 50 times as many telephones as the poorest fifth in the world. So it is a problem that is very complex. Of course, there is a rational imperative that for a household that has a poorer household that has a large number of children, the amount that the household can spend on each child, and therefore resulting in education and health outcomes and emotional and psychological development for those children, there are implications for that, and that is the rationale, and that is a very that's the rationale that we all are looking at actually in this talk today. But if you're looking at it in terms of curbing the population as a response to climate change, that might not necessarily be the way that we should be looking at it. For example, wealthier countries that have managed to control their populations are actually emitting more per capita. So countries with smaller populations have higher emissions, and they also have higher natural resource consumption. So I'm just the way that we have to look at it is that the measures to stabilize populations that we've seen in countries such as Bangladesh, the conclusions that we've come to, that the way that they were able to reduce their populations to stabilize their population between particularly 1975 and 1990 was not only the National Population Program, which was based on family planning and contraceptive use and promoting that. Some of the main factors were economic growth, and in particular, very interestingly, the expansion of the ready-made garment industry, of course, related to economic growth. And then other contextual factors, of the garden variety socioeconomic measures, so sustained political commitment of the government, maternal and child health-based strategies, networking of field workers and clinics, having a committed field force. These were all measures that contributed to the outcome that Bangladesh was able to see. But at the same time, how we say that this is a wicked problem, because for these garden variety of socioeconomic measures to take place, and in particular, which are related to economic growth, and I'm not even touching right now upon the patriarchal systems that make it difficult for women to have bodily autonomy in countries such as ours. But unfortunately, conventional pathways of economic growth and human development are involving processes that intensify climate change and put more people at risk for climate change impacts. So it is a very, very complex issue to deal with. And some of the ways that we are going to have to deal with is to take a step back from conventional economic growth and the current models that we're looking at. And this is a big ask, and it's people like me and climate activists like myself who are very passionate about this. We keep saying it, but it's a very hard uphill task ahead to actually change the paradigm in which the world is functioning right now. So I'll hand over back to you for the rest of the questions.
Thank you, Anam. Again, I think that was very insightful. I have to apologize to the panel for naming this discussion as I have done. But I do think that there's something to be discussed over here, right? So while I agree completely that we cannot say there is any kind of causal link between population and climate change, when we look at Pakistan as a case study, and we look at the kind of dramatic, catastrophic climate events that have been taking place over here over the last I guess, 10, 15 years. We had the 2010 floods and the floods of 2022 of last year, which have destroyed the lives and livelihoods of 33 million people. We look at the heat waves, the rise of other extreme events such as flash floods, etc. one begins to think that, okay, so where is this heading? Where are we heading as a country? And is there some link where we can say that how do people support and protect themselves better in these circumstances? And does that mean that they have access to certain kinds of services, such as reproductive health services, that allow them to actually be better able, and for their children to be better able to build adaptability and resistance to these effects of climate change? I mean, I know this is a controversial argument, but I'm really trying to kind of find out over here that maybe what is there that we can kind of look at in terms of the effects and the issues that Pakistan is facing, and how can we really support reproductive health rights as a way to inform, or at least the discourse around how do you become more adaptable, how do you become more resilient to climate change. Could I start with Dr. Faisal Sultan, please, on this?
Thank you. I have the distinct disadvantage of having missed about a third of your question because of intermittent net access, trying to juggle between connections, but nevertheless. I think what you asked is, given what our challenge is and given where we are, after all, what is that one could do indeed to promote the idea of reproductive rights as well as improve access? I think, and it's very important to address this simply because if we look at the numbers, and I'm no expert on this, I found myself learning a lot on this topic from people like Dr. Zeba Sattar while I was in the ministry, and I was fortunate enough to have her wise counsel and of others. And what is obvious is that in our situation, a lot of people and a lot of women are actually clamoring for and need contraception as well as the facilities that enable effective modern contraception. So in other words, there is an unmet need that is much larger than what most people would imagine or think to be. When you ask around, the common perception is that that it's really an issue of where there isn't much demand or if there isn't much ask for this. So the first thing to solve is that there is indeed enough ask, enough unmet need in the system that needs to be provided for. And so because of this, it changes a lot of strategy that we should be adopting. And that has to do with the ability to reach and service those married couples who are unable to or still unable to access more modern methods of contraception. So I think it's not so much an issue of whether we have to sell the idea of reproductive rights being important or of the need for appropriate population planning and family planning. But it seems to me from the data that I have seen that a good part of the problem is the inability of our system to actually service those that already have their hands up and are asking for this help. We are unable to serve them because of the fact that we do not have enough financial backing of some of these programs. Two, they're poorly structured and laid out. We are unable to geographically co-locate the service where it is best required or it's most required. And very importantly, we are unable to do it in time. In other words, the most fruitful or most useful times to be able to provide some of this service are lost upon the system or upon the population simply because of our inability to provide them at the right junctures, which is very often during initial postnatal visits after the first child and so on. So, this is more a policy and strategic discussion, but some of the more operational issues that arise actually are important roadblocks in implementing the lowest hanging fruit of this all. Very briefly, switching to the original question that you had, which had to do with the issue of whether one could frame this as a rights problem or a right solution, if one could say. I think that is also correct, and that just because we haven't met the need for many does not mean that we cannot address or should not ignore or should ignore the fact that a large part of the population also must become or be made aware of the challenges that an unplanned family brings together in the entire domain of life, all the way from healthcare to education to furthering their economic cause and surviving all the challenges that come through the climate change and other challenges that we are seeing in everyday life. So I think it's a bit of both. I do think that there is this unmet need which that needs to be unlocked and sorted and supplied and provided for. And at the same time, we also need to look beyond and see, okay, what about the others who are not even interested or not aware of the importance of ensuring that they have planned their families well. I'll stop here. Thank you.
Thank you, Dr. Faisal. But Dr. Aisha, I want to bring you in here right now just to ask you, so do you think that, at a practical level, should disaster preparedness and response include these kinds of services?
Short answer, absolutely yes. I think, and this is something that Pathfinder is deeply committed to in our climate change and women resilience work. I think we really think that in a disaster response mechanism, the immediate needs of the women and children usually are deprioritized in the form of relief efforts that benefit the whole population. We've seen women and children being more affected by it, and reproductive health needs of women are the last of the agenda. I mean, who really thinks of family planning and contraceptive commodities at a time when there's flood relief going on? And we think that that's a time when women and children are most at risk of ill health and the causes of high fertility and the impact of high fertility post the catastrophic climatic event, where all of this effort to give them the right that they have, to allow them a certain level of body autonomy, to reduce fertility and the impact of poor or of high fertility on upcoming health issues and systemic impact issues. Services will be less available to if there are more and more people and the service structure isn't keeping up with the needs of the whole population. Then you'll have poorer and poorer effects and poorer service of quality of services. And that's really what we are committed to. We're saying that any disaster response mechanism, immediate, post-immediate, and longer term, must include reproductive health and sexual reproductive health services, including contraception. And that's really our really firm belief in terms of Pathfinder. And we are really committed, and we're actually working with government institutions to integrate some of that within their disaster response mechanisms. Over to you.
So Dr. Adil, what would you say in terms of the fact that what should disaster relief and adaptation maybe cover? Is there can we say that there is a link, that family planning or reproductive health services are important in this process? Because my next question kind of leads to something which I want to sort of discuss with you, which is around the commitments that have been made, right, for relief and rehabilitation efforts. So, but please go ahead first on this.
Sami, I'm smiling because I think you're trying to force a link. Link to hai. The link is real. But let's not bring out real links. So let me put it this way. The reproductive rights are rights. Whether there is climate or not, it should happen. Are you saying that we should only provide reproductive services in disaster? If there is no disaster, we shouldn't? We should always be providing them. And if we are always providing them, then we should also provide them in disasters. Now, let's be very, very clear about this. Yes, poor people suffer from climate change, but they don't suffer because there are too many of them. They suffer because they are poor. So if you want to do something about poverty, and they won't suffer. There are poor people in low population areas in South Pacific whose climate disasters are even worse than ours. They still suffer. The causality and the linkage is to poverty. Now, this is why it's you've put me in a difficult position. Yes, we have to have services for reproductive rights, for reproductive services available, including in disaster, including in climate resilience, including in climate rehabilitation, but not because of climate, but because those are fundamental rights. I think they are human rights. So what we should really be doing is that these services should be provided all the time. If they are provided all the time, then they were automatically part of disaster relief. Let me cut through the mist, if you like. I hope I'm amongst friends. I'm certainly amongst people.
Yes, absolutely. And I've enjoyed it.
The question is, should some of the money supposedly coming for climate be also used for population? Okay, but that money is not going to come. There is no track record of the world actually paying this money. There was a conference, they had to promise something, so they did. By the time it comes, it will be wrapped in 20 things. I'm being cynical, but I'm not being entirely cynical. I'm old enough here. Dr. Zeba might also smile at this. When I started working on environmental issues, this is the late 80s, early 90s. Climate was not even a word. The big issue, the big table, the thing that everyone talked about was population. The environment walas were Khudaline. We were on the side, our institutions were small. There was really no money for it. We didn't go to the fancy conferences. The big institutions were focusing on population and so on and so forth. And I've written about this sort of piggybacking effect across the world. And climate people or environment people at that time were they were the ones eager to make the link. And frankly, they were making the link partly because if you link yourself to the big issue, then there is the likelihood that some of that attention will also come to you. We were making the same link between environment and security, for example. And that is when I started sort of writing and talking here. This is not the way to go, because you ought to be sort of talking about the importance of your issue itself. Otherwise, you take two Khuda line issues and you join them and you make one big new Khuda line issue. That's all, right? And Khuda line issue meaning that what is not getting policy attention. My point is, population should get policy attention on its own, irrespective of climate. Right? And now it seems that there is this momentary period when climate is getting a lot of attention. And as a friend and as a population person myself, I mean, I've written enough about it. I feel deeply about it. My worry is, you make this link, jo aap cha rahi hain, you won't get any of this money out of this Geneva conference, because that money isn't going to show up, and climate is going to disappear very soon. Climate has already disappeared. Have you noticed that we talk about the floods only to international audiences? Open up your television channels and tell me which one is talking about floods today. Which one is talking about climate today? This is a nara, this is a slogan. So what you will do if you force this link is that you will make the argument to the public that population should be important only because of climate change, and then climate change is going to disappear from your screen because some other nara is already more interesting on Twitter and on Instagram and on your local channels. And then you will have a lose-lose. Right? So I think for countries like Pakistan, whether we are talking about population, whether we are talking about development, whether we are talking about health, whether we are talking about education, these 4-5 big lever issues that make real differences in the future of societies, we should be talking about them. Yes, the linkages are real. There is no debate. But rather than lumping them, we should be talking about them as priorities in and of themselves. In and of themselves. Yes, population services should be available always, but they should be available always, even if there's no flood. In fact, making them available only as disaster relief would be a disastrous idea, because you want them to be available 24/7 all across the breadth and length of the country. So maybe I'm getting more excited about this than I should, but I am trying to sort of alert based on this experience. Climate is going to be, or at least seems at this point, it's a reality physically, but as a policy priority, it is not a reality, certainly not in this country. This supposed little international attention you are seeing will not last. And it will come mostly, because it has come entirely mostly in recent years, wrapped in carbon control. You do not have international support for the type of climate action that all of us are talking about. Have you seen any climate monies that come for development? Have you seen any climate monies that come for poverty rehabilitation? They will come for solar panels, they will come for carbon control, and in the carbon control, as I was pointing out earlier, I teach, as you mentioned, in Boston, currently spending this term at Oxford. This is a debate I have with my colleagues here. You go to the Environment 101 class, and the argument is always that simplistic one that I put, because it's an easy argument. It distracts from the argument that the change has to be in people's consumption, right? And population becomes a much easier one. I go back to what I had said earlier, IPAT. That was the right formulation. And that is the link. Yes, it is a link. But if you want to manage carbon causality, then the place to look at is affluence. If you want to manage impacts, then the place to look at is in fact poverty and the well-being of people. The good news is, and this is, I think, where that alliance between population and environment and climate should be happening. The good news is, if you make people's lives better, if you make their health better, if you make their income better, if you give them better opportunities, if you empower them, population management becomes better, and climate resilience becomes better. So the solution to both is, in fact, good development. And that is, I think, where this alliance should come, rather than sort of in the divvying up of the turf. And I know none of us are talking about divvying up of the turf, but I'm sitting in environments where that's a very popular argument. The sophomore argument in all colleges in the US is, this is really caused because there are too many people. It's not caused because I'm buying too much from Amazon. The forests are being cut because poor people like cutting forests, not because I like buying things from IKEA every second day, which is bringing that forest in. So let me shut up there with apologies in advance if I've said something wrong.
So I think you're completely right. I am forcing this link, right? Why am I forcing this link? Because I'm finding that all of this money is going to be coming in. I agree with you when we say commitments of 9 to 10 billion, nothing. But say the World Bank has pledged 1.6 billion, right, for 5 projects.
Wake me up when that comes.
But so if they have, and Dr. Zeba and Anam, I'm going to come back to you two very closely on this, right? So they have committed, they've got certain projects apparently in the pipeline, and these projects are all for housing and livelihoods. And I've worked on livelihoods projects for the last 10 years, right? And all my livelihoods, all the impacts that we were seeing pretty much in all the districts we were working with were wiped out with these floods. So 10 years of work, and I think, okay, that's just me feeling my work, but I look at those communities and those villages and those households that we were trying to support, it's all gone, right? So I'm trying to say that is there an opportunity here for us to say that, reproductive health, family planning, women's rights, sort of empowerment, the empowerment we say is necessary for people to become better, is really something that we should be connecting over here in terms of trying to connect these dots. So I know it's a bit of a convoluted question, but maybe Dr. Zeba, would you be interested in talking about this?
I think that if you, Samya, since you are so keen to conclude on a positive note, I must say I smile and I agree with Dr. Adil Najam. I don't think the money is going to fully make its way, and it will make its way into infrastructure. I doubt it very much that it'll be. I just quickly looked to make sure, because I'd read this rehabilitation strategy about which came out about 2 months ago or a month ago, and I saw nothing about population or a little bit about gender and gender violence here, a mention of health. It's not going to make it here. But I think what Dr. Faisal Sultan Sahab is saying, and I think Dr. Adil Najm is saying, that we need to fight our fight. Reproductive rights are essential. Dealing with such high rampant population growth rate is damaging our development agenda. Has to be central to our agenda, development agenda. I think social justice is the one that you can really ride best, I think, because services are not reaching certain parts of the country. It is really the poor whom we are not reaching most of all. The rich can make do, like they can educate their children, they can find ways to control fertility or reduce their fertility or have the number of children they want. So I think if you frame it in the argument of social justice, about really that it is the poor and hardest to reach populations in Pakistan, you have to make them stronger, part of their resilience, and develop them more, make their livelihoods more sustainable. And that one of the aspects of that is really not having unwanted children. And we know that out of 9 million pregnancies, 4 million are unwanted, and the major part of these annually, and the major part of these pregnancies are happening to the poorest of women. So I do agree with Dr. Adil Najam. It is really addressing the poverty issue and making families more resilient. And then, yes, providing them family planning information and services is part of that package to get them out of their very vicious cycle. I'll stop here because I know you want to include other speakers. Thank you.
Yes, thank you, Dr. Zeba. But Anab, going to you, where do you stand on this kind of grid of looking at, these commitments being made, but also, what should happen in terms of how do you make people more resilient in the aftermath of these disasters?
Thank you, Samya. So, as the discussion, we all know, and we all, I think, agree on some level with what Dr. Adil is saying. The question is not really so much anymore about the relationship actually between carbon emissions and population, and then natural resource consumption and the size of the population. There's not a very strong correlation there. That's something that we've established through this conversation as well. And if we're talking about population in particular, the 4RF framework that was developed for this Pakistan conference in particular, as well as the national climate change policy, this set of measures that, for example, the 4RF framework sets out for recovery and resilience to these floods are actually, again, I'm going to refer to the socioeconomic measures that I did before, but they include things that would automatically lead to improved outcomes in terms of stabilizing population growth, in terms of improvements in women and girls' education, empowering them economic growth. And then, of course, with those would come things like bodily autonomy and the right to choose how many children to have, and the choice, and the ability to make the choice as to how many children they would have. Access to contraceptive use and family planning services is not really a guarantee of their uptake. It's actually a culmination of all of these other factors that have to do with economic growth and empowerment and bodily autonomy and challenging existing structures. If I'm going to look at it from a climate point of view, again, agreeing with what Dr. Adil and what all of the other panelists have been saying, the real correlation between climate change and carbon emissions and natural resource consumption has actually got a lot more to do with affluence. And one of the measures, or a few of the measures that we can take as part of a just transition, is challenging the existing economic growth paradigm and challenging the legal and taxation structures that allow concentrations, such intense concentrations of wealth in certain individuals within lower income countries, as well as intense concentrations of wealth even in the higher end countries where you have extremely poor people and then you have extremely rich people. So what are these existing economic growth paradigms? What are these taxation structures that we could actually challenge using financial instruments that are being developed as a result of climate change? So one of them could be the carbon tax model, but not a carbon tax model that is currently being proposed or in some cases rolled out in some countries, which is overburdening already stressed out populations, but carbon tax models that actually proportionally take into account who is wealthier and who is actually emitting more carbon, rather than a blanket tax that would burden already overburdened populations. So there are a lot of lessons to be learned from various countries, but the key takeaway that we have is resilience building in general, addressing vulnerable populations in general to build their resilience. And resilience is not some buzzword for climate change. Resilience actually just is a repackaging of what we refer to as development. So investing in the development of our women, our girls, and of course of everyone, of the young population. As Dr. Zeba said, we have so many young people. A majority of this country is now young people. Empowering them, educating them, having their economic growth, sustainable economic growth, that's a separate argument. But that in itself would probably lead to positive outcomes in terms of stabilizing our population.
Thanks, Anam. So, Dr. Faisal Sultan, can I ask you, you have headed the National Health Service, right? So when we talk about resilience and adaptation, and I have to say, I definitely, I have given in and I agree that each of these issues needs to be taken separately. So yes to that. But in terms of, say, building resilience, how is the health service able to do this, and is it going to be able to do this, given that I think the population welfare and the health are two completely separate sort of ministries or entities? So where do they interact, and how would they build resilience among populations?
Oh God. So this has been a pet problem, if one could call it that. I think this was a natural consequence. The original intention, perhaps, was to give greater focus and greater impetus to population and the interventions that it required by giving it an exceptionalism or giving it an exceptional handling by creating separate ministries. What happened, however, is that it delinked what were fundamentally linked operational issues. And so therefore, what we have seen both at the federal level, and the federal government's domain in health is the size of the Lal Killa. It doesn't extend beyond the red zone. I used to, jokingly say that when it's actually true. But even if you look in the provinces, the big province Punjab and the others, in almost all places, the structure for these two are separate. And until and unless some cohesion is brought, word geolocation in a very effective geolocated way would not happen without it. And it's not, people have tried saying, okay, fine, have a common minister between them. And that really doesn't solve the problem, because the line staff being separate looks different ways and have their own incentives aligned somewhat differently. That's, again, somewhat operational, but I think that is one challenge that needs to be sorted. I thought we had the opportunity to be able to do it, given that the party at the center had two provincial governments as well, but there was enough momentum. Nevertheless, one doesn't give up on that. And so to build resilience into, now we're talking resilience not of the population or of our, the country, but the resilience of the health system and the population systems to be able to deliver what they ought to be able to deliver. I mentioned this a little bit earlier, and having these chronically underfunded and not appropriately logistically aligned wastes the money that is spent on them. And when you actually dig deeper and look at what it is spent on, a large part of it actually goes into the usual, operational expenses, and the actual direct expenses on where family planning products or contraception could be provided remain chronically underfunded. But there is also the issue of how if you're going to match up that unmet need, the gap, the delta that exists between what is and what is required, what Dr. Zeba Sattar was referring to as the number of unwanted pregnancies. If you're going to be able to address, or if you want, the aspiration is to address those, then the sheer increase in the ability to deliver is of a kind or of a number that will not happen entirely through the public sector. You will have to have private sector intervention into it. And that kind of partnership will have to be not boutique, but a holistic, organic, across the board cooperation and engagement to ensure that you are able to deliver what you want to another, which is contraception to those that are asking, the coalition of the willing. The unwilling hai, if you will, I don't know how many those are, but one only discovers when one actually goes to them. So both a galag story, but just to actually deliver to those that are willing would require, a 6x increase in the bandwidth that we currently have. That requires money, that requires some planning, and that requires a little common sense as well. I'll close by just giving you one little example, and I apologize, this is borrowing out of COVID, but that's the one subject that I do know better. When we were planning out adult vaccination, Mr. Asad Umar, who was the federal minister for planning and the chair of the NCOC, once looked at me, smiled and said, look, Faisal, you will have to give, you meaning the health system, would have to give 250,000 doses of adult vaccines a day. And so we had never done a day of adult vaccines. We were failing even in vaccinating our kids. And I sort of shuddered and I thought, okay, fine, we'll have to really retool this. But this very system, this exact system that barely delivers in many other circumstances, delivered 2.3 million doses in one single day. So clearly, aligning everything and unlocking some of the roadblocks does allow even this rickety system to deliver, and it did and does when required. So I think that it's not all doom and gloom. There is, and if there is consistency of policy across governments, because governments change, but we must be very clear that this is something important for all of us. And the Bangladesh example is classic. They might have switched governments a bunch of times, perhaps many times, but they've been very consistent in some of these areas of public policy. So I think this is one thing that we do need to adopt and put through with institutional memory all across. Thank you.
Okay, so I thought, how am I going to end this session? And at this point, I think it's sort of very clear to me that there are individual areas of work that need to be done, and maybe sort of looking at linkages or causalities is not the way we should move forward. However, there is a need to look at social justice and what does that actually mean, and break it down, and then look at those areas separately and try and make policies and plans to achieve some of the goals then that we set for these areas separately. I really want to thank my panelists, because I think you all have provided a lot of food for thought for myself and all those who are watching and listening, and also sort of gives me the opportunity with my team to sort of go back to the drawing board and really look at where we go from here. Because hopefully we all, at the end of the day, I think we all want to do what's best for Pakistan. And, I look forward to potentially having future conversations with you all on maybe individual subjects and maybe some one-to-ones as well, because the issues and some of the solutions that have been brought up here need to be explored further. So thank you very much for your participation and look forward to having you again as part of a policy roundtable.
Thank you.
Thank you.
Thank you so much, everyone. Bye.